I support Planned Parenthood because of its extensive history of providing basic health care services to women and girls in Maine and elsewhere. I support it because it's fair and non-discriminatory, non-judgmental, and provides comprehensive services. Obviously, we need health care services, and this is a vital part of the whole picture of health care services for people in Maine. Well, I would support Planned Parenthood and family planning services and facilities, try to expand them to areas where they're not accessible now. I introduced a bill already, and I would reintroduce that bill as governor to allow scope of practice to be widened, to allow non-physicians to supervise and perform abortion services in Maine. And I would support school-based clinics to provide comprehensive health care to school-age children, middle school and high school age. They naturally need to know about reproductive rights and reproductive alternatives. I would veto any bill that restricted those rights, such as the bills that I voted against and worked against when I was on the Judiciary Committee in the legislature, bills that would require parental notification, parental consent without the judicial bypass that we have in law now, bills that would impose restrictive licensing and inspection processes for facilities where abortions are performed, processes that are unnecessary, unsupported by fact or reasonable regulations, and bills that would require reporting, additional reporting of abortion services, abortions provided in Maine, with the idea that somebody might have access to those patients' names and contact information, which would be cruel and obviously unnecessary, not supported by any reasonable need for research. As the mother of 5 daughters, 5 grown daughters, who raised them through their teenage years, I'm keenly aware of the need for services like this in the state of Maine. And as someone who grew up in western Maine, rural Maine, I'm keenly aware of the differences then and now and the need to make further progress so that women and girls have full access to reproductive health care in the state of Maine. Well, first is Medicaid expansion, which we're working on now. It's in the law. We're defending it in the courts in the state of Maine. And I was pleased to have actually found $35 million from negotiating with tobacco companies to support Medicaid expansion and Medicaid services in the Fund for Healthy Maine. So that's one step, Medicaid expansion and expansion of services that aren't covered by Medicaid, and insurance requirements where people have insurance under the Affordable Care Act, and I'm now fighting against the Trump administration's attempt to roll back the contraception mandate under the Affordable Care Act. I think that's critical that insurance plans have contraception availability. I support Planned Parenthood because access to full reproductive health care is vital to the independence and integrity of women and children, women and girls in the state of Maine and everywhere in this country.